this changing time. Male factor, sometimes, the semen analysis, of course, they delay it in getting it done, then they come, then the semen analysis, I find that the parameters are deranged, count is less, motility mostly rather, not sometimes, morphology is an
Since
issue.
we're changing time, what exactly is subfertility according to your?
See, there is something called as infertility and there is something called as subfertility.
Right.
Now, infertility, we all know that the definition is when the couple has been trying to conceive for 1 year and they're unable to conceive. Right? That's the time that one should look for an evaluation for that particular couple. When you start evaluating the couple, and sometimes you find no reasons to say that why they are not able to conceive, it could be just unexplained. But sometimes you find just some mild parameters in the semen analysis are deranged. We know the WHO criteria that the count should be 15 million. But let's say it's not 15, or motility should be 40% total and progressive together, rapid and progressive together. Or the morphology is 4%. Let's say the count was 12 million, morphology 2%, and motility of 30%. So where will I place this particular couple in? I'll call it subfertility. Maybe there are factors in a female. She ovulates 1 month, she doesn't ovulate the other month. It is something which you cannot label it, but the female will require some kind of a treatment from an infertility specialist. So these are all the situations where I would label them as subfertility.
So for you, a couple who is hardcore tried to conceive a child and haven't been successful for over a year are infertile couple, but then they don't exactly.
I still don't call them infertility. Begin the evaluation for basic test is what I say before labeling anybody. And I don't even call them patients. They are neither physically ill nor mentally ill. They have come to you as a client. I do not even call them as patients. They are clients for us. The definition of a patient is a person who's physically ill or mentally ill, but before an evaluation, how do you label them? So I mean, definition wise, I would still debate that also.
Okay.
Asking for an evaluation is what I always say, that please ask for a semen analysis should be the first test whenever the thought of having a child crosses a mind for a couple. Do not ask the woman to come for a test. I have time and again said it. Do not bring a daughter-in-law or a daughter. Bring the son or the son-in-law first.
Yeah, that seems to be an issue that a lot of doctors are raising.
Yes. So the first test where the treatment of a woman will be decided in the course with us in an infertility clinic, I would say is the result of a semen analysis.
Right. So we in India are going in there.
The woman is absolutely normal, but if the semen analysis is 1 million count, what does that woman have to say? You don't even go further. I think just prepare her for an IVF ICSI cycle.
Yeah.
Isn't it?
Yes, exactly. So in many cases, we are going about it wrong.
Absolutely.
And I believe male diagnosis is a lot more non-invasive than women diagnosis.
Yes, it is but a taboo there, and the willingness to come forward, I think, is what needs to be changed. And I think it needs to be understood that it's not always a woman.
Right. I was very interesting because I was talking with a psychologist who deals with reproductive issues. And she also said the same thing. Even for her, for patients to come, for male patients to come is a big thing. So
yes,
facing the same problem there.
It is. Most of the times I see women walking, I've just come, they will not come with their husbands, they'll come with their mother-in-law or maybe the mother or sister-in-law. Not able to conceive. As they, there's already that she's accepted and labeled herself that the problem is with her. There is absolutely not even an iota of a doubt on the male partner.
That's very unfortunate. Why do you think this is
unfortunate?
Right. Why do you think this is happening?
I think male ego, patriarchy, system and belief that have been already been carried over for age and time, but now times are changing, so it is the awareness is there and people are understanding about it. So male infertility has become a separate specialty by itself.
And the stigma seems to start from the family, right?
Absolutely. It starts with the family.
Yes. Ma'am, so
because they will never question their own son.
Yes.
Why aren't you having a child? But they will keep asking the daughter-in-law.
Yes, and
why not even talk about it to your own child first?
Yes.
I want to ask this in my counseling. Why is the woman always being questioned in the house and why not the son? He was born and brought up in that house. The lady has just come after maybe just a few years ago, maybe a year ago, 2 years ago, 3 years ago. But she's answerable, but not the person who was born and brought up in that household.
Bang on. Right. In fact, I came across a story recently where a recently married couple for a little over 2 years, they're not able to conceive. So there is a lot of shaming and a lot of guilt tripping for the woman. And the male was refusing to go for treatment. And words reached till the extent of divorce. And then the guy decided to go for a treatment. And it was learned later on that he had azoospermia. And
I've had a patient from Haryana belt where the family said that, why don't you use the sperm from somebody in the family and maybe the father of the boy, right? So I said, this is almost like an incest. So, I mean, how is it possible that I do it? If you don't do it, doctor, you will be ruining her life because he will get married to her younger sister. And the problem was that he was azoospermic. So to explain to them and to counsel them and to bring them out of that system, it's a big, big challenge there. And it's only the woman's life which is at stake because she's being threatened all the time. If no divorce, a remarriage.
Yeah. How do we go about solving this kind of stigma?
I think just about raising awareness, talking to them, raising so many campaigns are there, so many programs where male infertility is highlighted all the time. And I don't see a patient in the first meeting without the husband. And I think I asked for a visit.
That is very nice.
Free consultation, free semen analysis, free consultation, motivate them that please come as a couple. We will begin, only the first test that will begin is first with the semen analysis and we'll do it for free, but then come over.
That is such a good start. Thank you for that. So, ma'am, in your years of experience, what are the top 3 reasons of male and female fertility?
I think male factor, sometimes, the semen analysis, of course, they delay it in getting it done, then they come, then the semen analysis, I find that the parameters are deranged, count is less, motility, mostly rather, not sometimes, morphology. With females, of course, age has changed now. Girls are not getting married in 20s, they're getting married in their early 30s because everybody is busy settling their careers, balancing their life. And I always tell them that come ahead, come forward for egg freezing. If you are not finding the right partner, you're wanting to delay it deliberately, you want time to settle in an arranged marriage or a love marriage, you want 3 years and then. So before your 35th birthday, you must freeze your eggs. Then do what you wish to.
So age is the biggest concern.
Yes. Now the trend has changed because now in this generation, where do you find girls getting married in their 20s? It's mostly 9 out of 10 would be in their 30s.
Yeah.
Or 8 out of 10, if I have to say.
Yeah. We feel women getting married too early.
And the other 2 out of the 10 would be 26, 28, not before that. So they will even start planning a child when they are touching 30.
Yeah. I mean, personally, I feel women who get married too young is such a loss for the society and for giving back to society. So maybe that's why I'm unmarried yet. Yeah. So, ma'am, does age affect male fertility also?
Yes, it does, but not as fast as for the females, but males also, the age is a factor with sperm parameters. We take it for granted, but if you look at it, age definitely has an impact on male factor also.
So just to stress this point that we have discussed, fertility or infertility is a couple's issue, not a woman's, not a male's issue, right? A couple's issue.
Yes, absolutely.
And so we have, as a society, we have to go about this as a couple, not as a woman problem, not as a male problem.
True. Very true.
And you insisting on the male partner being present is a very refreshing start, and thank you for that. Now,